As I imagine everybody in the NHS knows, the service has an enormous backlog of cancer work, partly created by the pandemic, though the waiting lists were under significant strain before that crisis. What we're talking about today is how is that challenge best met in a way that is efficient, we get through as many cases as possible, but also equitable. Those in greatest need get treated first.
In the beginning of the pandemic, we realised that we were going to build up a big backlog, particularly in diagnostics, and it is such an enormous problem that it's going to take quite a lot of diligence to fix it. That's exciting because we've got the space and opportunity to think differently, and we can really challenge the system. We really need to keep pushing the system to keep that innovation coming if we're going to meet that challenge.
The long-term plan was all about earlier and faster diagnosis, as well as improving patient experience and outcomes, of course. The pandemic heightened that need to make us work together as a system, and that's why we welcome the incoming integrated care systems.
Those ambitions have long been embedded in the long-term plan, but with the new refresh of the 10-year plan for cancer, we're seeing an expectation to accelerate to be able to improve outcomes for patients.
Leading the Alliance in Greater Manchester, all the things that concern cancer we cover, particularly how we get back to where we were in terms of cancer rates for patients, reducing inequalities, and then the survival, early stage diagnosis. One of the things I think we need to do is more targeted screening, particularly lung health checks and other approaches.
The interactive session we had looking at how to improve outcomes in breast cancer over the next 10 years and how to build back following the pandemic was really valuable. We heard how challenging it is dealing with the new demand workforce, of people experiencing real burnout, and then some really interesting conversations around how to gear the system up for the needs of people experiencing metastatic disease. So as treatments become more advanced and more successful, we're going to have more people living with more complicated needs for longer. So how are we gearing up for those people?
This is my first time attending one of these events, and I feel like I'm going back energised and with a greater purpose.
Many conferences I've been to, they've been much more clinically focused. I've been really impressed with the broad nature of all the different topics that have been covered.
And I know that everyone's busy. It's finding the broader cancer community that has also enabled conversations beyond healthcare in both NHS and local authority, public health terms, and there's a richness in being able to do that that's been invaluable.
There's never been a bigger need for innovation, and that's why I'm here, trying to get some new ideas.
Sharing that good practice for the benefit of patients. There's nothing like face-to-face, and we need to get some of this back so we can be even more effective than we already are.
That's what uniquely you would get in an HSJ forum, the mix of very senior people being addressed by the leaders in the field and a rich conversation between those groups about how to best meet those challenges ahead.